Good morning, everybody. Welcome to our session on Brexit. When we wrote the description for this session, we said that there were still more questions than answers about Brexit. So I'm very relieved to say that that situation hasn't changed. We've got two fantastic speakers who are going to talk to us today about the potential impacts on charities and on the hospice sector. They're going to speak for 20 minutes each, and then we'll have a debate. So please do, as they're speaking, note down any thoughts, anything you disagree with, anything you'd like to share or challenge, and hopefully we can have a good 20 minutes for debate at the end of the session. So without further ado, I'm going to introduce Ben Westerman, who's a Senior External Relations Officer at NCVO.
Morning. Hi. Morning. So, thank you for that. Just very quickly, yes, nothing has changed in regards to questions and answers, and I would just kind of caveat anything we say now by it's probably going to have changed by the end of the afternoon. So, I'm going to just do a kind of a quick overview, really, of a charity perspective, but also a kind of broader perspective. One of the things that we hear at NCVO from charities a lot is that they want to know broader themes, because whilst there are, of course, regulatory issues that affect charities and a few legal things, there's also the broader impacts, both economic and social, of Brexit, which really affect the work we do, the environment we're operating in, particularly when it comes to economic downturns, any of that stuff. So I'm going to kind of go through a few quick questions, and I'm going to hand over to Tony, who's going to talk to you about health-specific stuff. So I'm going to look at what we know already, what's in the withdrawal agreement, and kind of what's in that is making people so angry, what charities could be thinking about, and then what the next kind of few months look like, what potential outcomes there could be. There'll be no predictions from me. So, just before we go on, obviously we are very much in the final stages of this now. I think it's 122 days left, so we're very last minute. The key date here is December the 11th, as we learned yesterday. That's when Parliament will be voting on Theresa May's deal. I will talk a little bit later about Parliament's role in all of this, because it's been, in my opinion, wildly misrepresented in the news. It seems to be misunderstood by people within Parliament quite a lot. So I will just talk a bit about what Parliament can do. The other key dates are January 21st. If there's no deal by this time, the government is compelled to make a statement within 5 days of that, in which it will tell us what it's going to do next, and what the next few weeks look like from that point. And then, of course, the only other thing to mention is the scheduled, in brackets. Obviously, I'll come to that in a minute, but we expect the transition at the moment to end at the end of 2020. That could well change, so I'll come to that in just a moment. And this is just a quite useful infographic in that it's kind of annoyingly complicated, but that's the annoying complications of the next few weeks. That's the kind of options we have now. Obviously, as you can see, 4 of them lead to no deal, which is quite troubling, but that's where we are. So, I was just trying to think about things that the sector can be thinking about, and some key messages for you to take away, and I just came up with 3 before I go any further. The first is, unsurprisingly, uncertainty. March 29th isn't going to change the uncertainty in this country, in policy making, in the economy, in social change issues, in any of the things that charities deal with. The uncertainty is going to continue for a long time. We're going to continue fighting about Brexit for a long time. We certainly don't get to 29th of March and stop hearing about Brexit, sadly. We should know by January, February what the kind of likely outcome of the whole process is heading towards as we get towards parliamentary votes and what's said about that stuff. The uncertainty will remain, and it's kind of incumbent on us to plot our way through that. The second is political status. Obviously, everyone here is affected by policy change that's going on in Westminster, or policy change that's not going on in Westminster. We have, since the general election, been locked at this impasse when it comes to politics, whether it's how you vote in the referendum, which party you vote for, which leader you prefer. We have we've hit this point where the parties are polling around the same place, kind of the 36 to 42% region. They've stayed there, they're not moving. Even in the last few weeks when the Conservative Party seems to have pretty much torn itself apart, it's still polling around the same. So everyone's kind of picked their side in all of this, whether it be on leader or whether they're Remainer or Leaver or what kind of deal they want. And that's where we are. The effect, of course, that has on us is that policy change is difficult, particularly on social change issues. It's not forthcoming. Government doesn't really have time for it, nor dare I say the appetite for it. The last thing I think that I really wanted you to take away is that we charities are on our own in this. That stasis has led to a place where Brexit takes up so much of the time of policymakers, of policy influencers, and social change issues are low on the agenda. I wish I had better news, but I seem these days, I was just saying, to kind of go around spreading sad news to people. It doesn't make it very popular, unfortunately. We have the technical notifications from the government. We have the information we've got already, but there's not more information forthcoming. One of the things about Brexit is that the government can only contingency plan so much, and it can barely contingency plan for its own operations. So it can't then reach out to the charity sector, to the private sector, to all these industries, and also help them. So it's really important that we think about what we can do ourselves. For me, that means the charity sector, we need to have conversations both collectively and individually. We should share ideas, we should talk about what we can do to mitigate some of the bad impacts, what we can do to take advantage of some of the opportunities of Brexit. There is also necessarily a sunk cost in all of this, in that if you're preparing for a no deal and you're preparing for Theresa May's deal or some deal, one of those two things is essentially a waste of time. But that's important. We have to plan for all those scenarios, and I think it is best in some ways when we're thinking about where we're going as charities to plan for the worst case scenario, so that we're ready for that, we're robust in those times. So everyone happy? Good. So the first question, what we do know. There are three things, triple rollover, that we do know. The first is that on the 30th of March, as it relates to regulation, EU rules will be rolled over into UK law. So as far as regulation and legal stuff goes, there is no cliff edge. Whether it's deal, no deal, whatever, that cliff edge doesn't come. The government, those laws will be based on the European Communities Act. That gets revoked, but those laws get passed into UK law. So as far as our environment goes, as it relates to regulations, there's no change. Channeling my Theresa May, no change. I won't do the dance. The second thing is that there are other international frameworks of which the UK is part that you may not think that affects me directly, but actually, if you work in health, that it's a very good chance you're down the supply chain somewhere, and that really does affect us. And those things still apply to the UK. So, there are some things in that sense that don't change. And the last thing we know is that there is also a lot of UK legislation which doesn't change as a result of living in the EU. So, in a regulatory sense, in the very immediate term, there could be more continuity than we're expecting, than we're told when we hear about cliff edge Brexit and all that stuff. It's the longer term that, of course, is the issue, because the government does retain the right to scrap all of those EU rules down the line if we want to. It can amend any law, of course, because it's the government. So it's the long-term impacts that have often been understated, both in terms of regulation, the economy, and, of course, the thing that people don't talk about much, the social impact of all of this. So, what else do we know? I'm going to talk very, very briefly. I'm not going to go through the withdrawal agreement point by point because, frankly, it's a bit boring. But I think it's really important for us as charities to understand why people are angry about the withdrawal agreement. Lord Ashcroft's done some polling recently which suggests that 46% of the public is against Theresa May's deal. Many of them can't tell you why, they just are against it, for whatever reason. That's where we are. So it's important for us to understand why people are angry about it. So for me, the role of charities is to heal those social divisions, and that's a big part of our role going forward. So just a few things about the withdrawal agreement and why they've annoyed people. Obviously, the big thing's Ireland. The backstop solution sees us essentially staying in a UK-wide customs union if a solution can't be found to avoid a hard border in Ireland. That has really annoyed Brexiteers because it stops the UK from striking free trade deals around the world. It keeps us in a customs union, which a lot of Brexiteers are quite anti. The second thing, which is quite of interest to charities, is the commitment to a level playing field on state aid. That's really important for charities. It prevents the UK from lowering standards, in my opinion, a really good thing. It prevents the UK from lowering standards on social regulation, labour regulation, environmental regulation. It signs us up to those EU things, essentially copying and pasting them into UK law. For Brexiteers who saw this as an opportunity to lower tax or loosen regulation, that's a big loss. They're really, really angry about that. Then, of course, there's other things like there's the ability of the European Court of Justice to continue arbitrating on some issues. There's the extension I mentioned to the transition period, which keeps us in a customs union, and there's an end to free movement, which, you know, if this is all about immigration, then why are people still angry about this? Leads us to think that maybe there are other things at play here. Is it about sovereignty? Is it about the general state of the country and what's not working for people? And that's where charities can come into the conversation in a really big way. So basically, we've got Brexiteers angry because we sacrifice sovereignty. We're restricted as a kind of global Britain idea. The Remainers are angry because essentially for them, what we've got, this deal is worse than EU membership. So in some senses, Theresa May really is stuck between a rock and a hard place. Beyond that, there is the big impact of all of this, as I say, is uncertainty. The economic impact of potential trade difficulties. Border checks have trade impacts, they have political impacts, and of course for people. There's a huge impact for people. Again, something in this sector is really, really, really important for us to think about. We still don't have an outline plan for the government on what their future migration system looks like. We have recommendations, but it's not been put into put before Parliament, it's not been put into a white paper yet. So with all of this, we of course have the threat of no deal, and what does no deal mean for those people? We don't know. We certainly know that we might see what happened immediately after the referendum, where EU citizens who are here might not want to stay in the UK. It's more of a political than I guess a cultural thing than an actual legal thing. They might kind of reduce their pattern of social engagement and kind of recede from feeling like they're citizens of this state, which is obviously very important for charities when it comes to volunteers and people in things like social care, which is a very, very EU national heavy thing. Then more widely, we might see an investment strike, we might see, well, we are currently seeing slow economic growth, and had we stayed in the EU, some economists tell us that we are closer to the next recession than the last. So of course there are huge impacts considering all of this. And the reason I'm talking about this is because, as I say, these are wider things which they're not primary effects on the sector, but they affect massively the environment we're working in. And for charity, if we have a recession, even if we don't have a recession, we have increased economic hardship. Charities' roles then becomes really, really important because we have growing need. People need charities more than ever in that environment. We also have the no deal technical notices, some of which are, incredibly specific. My favourite one's about travelling with your horse. Any takers? No? But generally they're quite generic, they're quite cross-cutting, and as I said, that's all we've got. That's all we're going to get from the government. So those broader ideas are things to think about for us as charities, and I'll come on to the specifics next, but they are really important for charities if we're going to have a voice in going forward. If we're going to do Brexit, why are we doing Brexit? What is our role in the conversation going forward? If we have a divided society, how can we as charities and voluntary organisations who are based in communities start to heal those divisions, at least start to address them and address why the anger is there in the first place. So for charities, I'm getting a bit of a theme with the uncertainty thing here. There is the economic uncertainty, and I'm now going to talk just very briefly about some more specific considerations for charity. I'm trying to boil down what this huge complex operation does to charities in about 5 minutes. It turns out it's quite difficult. As I say, charity is not on the government agenda, so there's a few things we can look at, kind of reading through the lines that are going to affect us. The first one, of course, it will come as no surprise, is funding. lots of charities, particularly in health, have received important EU funds in the past from the EU Social Fund, from Horizon, from all those millions of EU funding programmes with silly acronyms. And we know from the government there is a pledge to continue EU funding until the end of the current funding cycle, which is the end of 2020. So successful bids between now and March into any EU fund, regional development fund, or the social fund, or whatever, will be delivered by the government. It will be underwritten by the Treasury, according to their current promises, which is really important, because it's really important that charities don't think, right, we need to back off. It's really important that actually charities still continue to bid for that funding, because it's so crucial. And if we are in an uncertain time, it will be so important that charities still have access to that money. Obviously, subsequent to that, we have no certainty as to what happens to applications. We obviously leave EU agencies, and we are waiting on the government to tell us essentially what happens to charity funding after that. We do have this one big commitment from the government, from the manifesto 2017, to a UK shared prosperity fund, which I'm sure you would have heard about. It's a fund that is not a direct replacement for EU funding, but is in all but name a replacement for EU funding, and it's aimed at regenerating left behind communities. We don't know how much money will be in that, crucially. That's really important, because it could be quite easy for the government to put a small amount of money into it. The other thing about it is that we don't know how it will be delivered. Will it be run by Whitehall? Will it be run by local enterprise partnerships? Will it be run by the devolved administration? How will the funding be allocated? Will it be based on economic value? Will it be based on need? Obviously, most charities are advocating for something that's place-based, that local government can get involved with, that is based on needs. Other things for charities, as I mentioned, state aid. This will go to the Competition Market Authority after Brexit, and as I say, we are going to end up signing up to most EU rules on state aid, because the EU has a very developed conception of what civil society is, and feel very strongly about that, and they will be putting that in the future relationship. I think we can pretty much guarantee that. Then there's the workforce thing. We've seen the number of EU nationals in this country drop. We saw 86,000 leave last year. Some figures came out yesterday from one of the various campaign groups, which told us that 15% of public sector EU nationals, sorry, other way around, EU nationals in the public sector dropped by 15% last year. So that has a big effect on things like universities, things like hospitals. And we have, they still live in a world of uncertainty. We know there is a settled status scheme run by the Home Office. We know that it's also way left behind. So me, for instance, my parents are both EU nationals, who will probably be okay for a while because my surname begins with W. And that sounds ridiculous, but the Home Office system is currently so far behind that just by being far in the alphabet, you're okay for a little while, because they'll just get round to you at some point in the future. But we do have some guarantees around that. We know that EU citizens currently living here will be able to stay. They have to register, they have to sign up as a light touch immigration system, but they will be there. So it's really important for charities to think about how they can help any EU nationals on their workforce through that application process. We can take audits of staff, work out who are EU nationals who are going to be affected by this, and how can we help them through the paperwork, because on a really human level it's just quite difficult to go through that. There are some obviously more smaller considerations for, well, I say smaller, less obvious considerations for charities, things like VAT. There's an opportunity around VAT. Charities pay something like 1.5 billion in VAT each year. And there's a big opportunity after Brexit to reform those rules, to lobby the government and say, look, we think that there needs to be a rethink of how we pay VAT, how much VAT we pay, how it should be based on social value, all that kind of stuff.
2 minutes.
Tax the same, 2 minutes, wow. And then I'm just going to kind of finish this charity section. I might take 2 minutes over. Do my best. The final thing to think about for charity, just some kind of general themes. As I say, there's growing need. If we have economic downturn, and economists hate agreeing on anything, but they all do seem to agree that we're going to have, at least in the short term, economic contraction. We have certainly had slower growth over the last few years. So if there is that growing need, if local government crisis continues as it has for the last few years, we've seen an increase to the 40% funding cuts there's been to local government in the last few years, then the role of charities will be crucial. Charities need to think about their income, they need to think about their income streams and their relationships and their contracts. They need to think about staff, and then as I mentioned earlier, the other thing to think about is the difficulty in policy making. Political classes will remain obsessed with Brexit for a long time to come. And so we need to think between ourselves about how we get social change issues on the agenda in that context, in a context in which the government doesn't really want to hear them at the moment. So very quickly, in maybe about 80 seconds, Parliament. And my big aim here was disabuse you of one notion, and I will start with that. I'll reorder slightly. I will start with that. Parliament cannot stop a no-deal Brexit from happening. Parliament cannot vote against a no-deal Brexit. We read this in the news pretty much every day, but it's going to be okay because Parliament will stop a no-deal Brexit. Parliament has no right to do that. The choice they have is the deal put forward by the government, or a renegotiated deal, or no deal at all. They can apply for an extension to Article 50 if the government agrees, but they cannot stop a no-deal Brexit from happening. So we are very much at the point now where a no-deal Brexit is a possibility. I'm not going to put a number on it out of 10 or anything like that because I just don't know. But it's certainly a possibility, and it's not something that, we hear a lot of Labour MPs, for instance, saying it's a hoax, it's not going to happen. It could well happen if each time the deal doesn't get through Parliament. The one thing says that the Withdrawal Act that's going before Parliament on the 11th of December can be amended. So MPs can strike blows with the government here. They can try and push it towards a softer Brexit. They can try and get commitments on certain things. If the Labour Party decides on its line, it might amend that if the vote fails on the bill, that we have a second referendum. There are lots of possibilities. We could have a no confidence vote afterwards. We could have, from within Parliament, we could have a no confidence vote from the Conservative Party, as we almost saw last week. Obviously, then they couldn't quite get themselves together. So just very, very quickly, within the Tory Party, obviously, it looks like it's going to vote down the deal. At this stage, we have 94 Tory MPs currently, with a majority of 13, remember. 94 Tory MPs saying they're going to vote against the deal, so it's all but certain that the vote is going to fail the first time. The pro-Remain Tory rebels, are kind of, there's 1 to 15 of them, the one always being Ken Clarke, and then there's a couple more, could end up voting for the government's deal the second time round, if in between, if the vote fails and then it has to go back to Parliament a second time with some maybe very, very minor changes that the EU weren't particularly interested in, then we could see some Tory MPs go, don't fancy no deal, better vote for this. Ditto, the Labour Party. I've tried to kind of be universally offensive to all political parties, so there's no start there. Ditto the Labour Party. Obviously the Labour Party is going to continue with its constructive ambiguity, not having a particular line on Brexit for as long as it possibly can, because its interest here is not particularly in Brexit, it's in toppling the government and forming its own government. The crucial thing with the Labour Party will be the rebel MPs within the Labour Party. Last night, Gavin Barwell, the PM's Chief of Staff, briefed Labour MPs on the deal, on the importance of the deal, on what their options are. And there's a chance that, again, if the bill comes to Parliament twice, and the second time Labour MPs are faced with the choice of no deal or this deal, that the pro-Remain Labour MPs will accept that this is slightly much, however you want to put it, better than no deal, and vote for it. There is that chance it'll get through on that. So, it's not that no deal is a certainty, or that the deal is certain. We really, really don't know. But as I stressed with the Labour Party, the big thing is always to remember that the no deal as a hoax line is itself a hoax. It's complete rubbish. Sorry to disabuse anyone of that notion. Final thing, really, I'm going to skip the slide very quickly because I appreciate we're out of time, is to do with the second vote, the second referendum. Again, I still think this remains quite unlikely. We could see some political parties try and push for it by amending it to the bill that's going through Parliament on the 11th of December, saying if this bill fails, we have to have a second referendum. We are seeing in this gain a lot of momentum. We are seeing more and more MPs throw themselves behind a second vote because they feel that the deal's bad. The one thing to say about that is that the EU's being clear this is the only deal we're ever going to get. But that's where we are. So none of this automatically results in a second referendum. It's totally incumbent on the government. The Parliament can't make the government call a referendum. It totally has to be Parliament's decision, the government's decision, sorry, and obviously at present Theresa May's line is very much there will be no second referendum. So I'm just going to leave you with what this says, really. Brexit's not going anywhere. That could be 2 months, 2 years, 5 years, 10 years, 20 years. It's not going to get off the agenda for a long time. What's important though is we in the charity sector don't have a bunker mentality. We must speak with each other. I think that's the key message from all of this I'd like to take away is that we have to be sharing ideas. We have to be thinking about what of the various tracts of Brexit affects our organisation. Is it the income thing? Is it the workforce thing? Is it tax? Is it state aid? Is it supply lines, medical supplies, fissile materials, anything? And we have to be absolutely sharing ideas of how we prepare for any eventuality, how we prepare for a difficult economic environment, which seems likely. But politicians are going to carry on doing this for the next God knows how long. And so don't be worried, be prepared. Thank you.
Thank you very much, Ben, for giving us that overview. Now delighted to introduce Tony Bowman, who's the Senior European Policy Manager at the Brexit Health Alliance, which is part of the NHS Confederation.
Oh, how do you do it? Oh. Falling at the first hurdle. Hello. Thank you for the opportunity to speak. I was slightly worried because when I checked in, the lady at the checkout the desk said I was here to motivate you, but I'm not quite sure. I don't think I'm going to achieve that. Just by way of background, I'm from the European office, and we're hosted by the NHS Confederation, and we're based in Brussels. What am I going to be talking about for the next 20 minutes? So, as you know, the UK votes to leave the EU, and this will happen on the 29th of March. So, just going to be talking about the main ways that Brexit could impact on the NHS, largely through no deal, some of the political implications, what the government is doing, things that you can be thinking about. I should say that slide is normally kind of delivered to people working in the NHS, so there might be stuff that you could take from it, and a bit of a Brexit start take. Also, just apologies in advance because my slides have loads of words on them compared to Ben's, and I don't expect any of you to please don't read them all when I get into the nitty-gritty of it. So, what are the possible implications of a no deal? So, I think given that the hospice sector probably interacts a lot with the NHS, I thought it might be useful just to view some of the issues that are top of the mind for the NHS and the wider health sector. You'll have noticed that no deal, the talk of no deal has increased over recent weeks, and no deal could impact upon the following areas: so supply chains, research and clinical trials, the provision of cross-border healthcare, information sharing, and public safety. I should say the way that we identified these issues is that we set up a group called the Brexit Health Alliance, and that alliance is basically a collective of providers, commissioners, people who work in the wider sector in industry and research. And it was through working with them that we identified that these are some of the key issues. And it's through the alliance we've been able to, I suppose, discuss and promote these issues with people with government and with our European colleagues to make sure that it's off the agenda and that health isn't forgotten. So, the first issue is supply of medicines. This one has definitely crept up the agenda over the last couple of weeks. It largely covers three broad areas. So we're talking about access, movement of goods, and the way that the goods are produced. So on access, this is largely to do with how drugs are marketed and supplied. So we're currently part of an organisation called the European Medicines Agency, effectively the organisation that licenses drugs that can be supplied and used across the European Union. We're going to be out of that anyway due to Brexit, but one of the things we're concerned about in no deal is to be outside of the regulatory system, so basically medical research, medicines, medical devices. One of the things, and Ben touched on them, is that the UK has issued quite a number of reciprocal notices, and some of them are on specialist areas like horse trade. One of the things to say about it is that what no deal will look like in the UK is dependent on how the EU chooses to reciprocate some of those technical notices. So one area is they've issued a notice on CE marking. We basically said, we will recognise the products made in the European Union and the ingredients that form part of those ingredients. The EU has yet to reciprocate that offer. So we can kind of make all the declarations we like, but cooperation can't continue as it stands if the EU doesn't reciprocate what we have said that we will do. Another area of concern with the EMA is, if you think about it, the EU is a massive market. You've got us and America. We know that from experience, countries outside of the European Medicines Agency tend to, they face additional delays in accessing new medicines. And this is the case for Switzerland. Switzerland aren't in the EMA, but they do have a lot of complicated bilateral trade agreements with the EU and the EMA. But they tend to, on average, gain access to drugs 157 days later than the EU. And that's obviously something that we're concerned about. Movement of goods. So a connected issue to this is about how goods will move in the event of a no deal. We know that the scale of trade between the EU and the UK is substantial, and just for context, for medicines, 45 million patient packs go to the EU from the UK every month, and 37 million come from the EU to the UK each month. So they're essentially the packets of tablets that your GP might dispense or you might pick up from the pharmacy. In the event of no deal, it's not clear yet how those goods will be moved across the border. We're a bit concerned about how customs checks might impact and might cause delays within the system. So this not only this is I suppose a concern for the pharmacy, so for pharmaceuticals and devices, because not all of the products that they produce are liable. They can't be stored for huge periods of time because some of them will have short shelf lives. Devices have the same issue. There's also an issue just around physical storage capacity. And this will also impact on the NHS, because a lot of parts of the NHS use the just-in-time process of delivery, as do industry. So there's a bit of concern about how the NHS, any delays at the border will then have a knock-on effect about how we can move things around the NHS and get medicines and devices to where they're needed. And then the other one is the development of how drugs and medicines are developed. So we know that over 2,600 final medicinal products have some stage of manufacture based in the UK. Products are often developed in complex supply chains across Europe, and any divergence from these harmonised standards by the UK and a lack of agreement on cooperation with the EU on medicines and medical devices could put some of the supply chains at risk. And I think the best analogy is the car. So you probably have seen that car manufacturers have been saying, in the event of a no deal, we're concerned about how we'll continue to produce cars, because partly they're relying on parts that are sourced across the European Union. The same is the case for medicine. So I'm sure someone told me, and it sounds a bit mad, but they said that you can have a medicine that can have 900 different ingredients, and they're all sourced across the European Union. If you think about the impact that will have on supply chains, it's a little bit concerning for us. And just by way of an example, so this is an issue. This is where you start to get into the issues of how this can impact on the European Union itself. So the UK is it's the only country to produce a particular type of prostate cancer drug. Because of the uncertainty about what's going to happen in the future, that company is now having to relocate or duplicate the way it manufactures that drug. So it has a base within the European Union. Because in order to continue to supply those drugs, you have to be a member state, or you have to have some form of agreement in place to continue to supply those drugs. And they've told us that it might take at least 42 months before that service is completely up and running, so they continue to supply that drug. The next area is research and innovation. Obviously, we've benefited massively from being part of the various European networks. Ben's already mentioned that the government is committed to underwrite funding for any programs you're currently in or applying to, and that's irrespective of no deal. I think one of the concerns that we have is that even though they've said they're going to continue to fund us, we're not certain how practically we take part in those research networks on a day-to-day basis. And the government are still sort of, I think, working that through. I have to admit, before starting this job, I wasn't too aware of these organisations called European Reference Networks. And effectively, there are 26 networks, and they are largely focused on rare diseases or really complex conditions. There are 26 of them, and the UK leads, I think there are 24, and the UK leads 6 of them, and one of them is an example of one being rare epilepsies. We're going to be outside of those networks, and we're already having to move over, reallocate the leads of those networks to EU-based hospitals. The practical side of that is that, if you're a GP in South London and you see a patient that they've got a load of symptoms that you've never seen before, you can go to one of these networks and they say, I've got this patient, I don't know what to do. And someone in Paris might say, I saw someone as well with these conditions. Let's have a conversation about what treatment plans are there, what are the options. You might discover that there are no treatment options. And then you can think about, well, what do we need to do about it? So the European Reference Networks, the more I found out about them, the more I speak to people about them, they're actually quite useful networks to be part of. And just as an impact that we know that Brexit is having on research is that there's a medical research firm called Ricardio, and they have said they basically suspended their UK activities until they know how drugs are going to be approved, and they were just about to start a clinical trial on a heart drug. So we can already see some of the impacts that are already taking place even before Brexit has happened. Reciprocal healthcare. So on this, it cuts across a number of areas, but essentially it affects people when you go on holiday and if you've chosen to live in another country. At the moment, we're all covered. In the event of no deal, there aren't any arrangements in place that will fall outside of those plans. You won't be surprised to know that more people from the UK choose to retire to the sunnier climes of the EU than come back. And there are currently 190,000 UK pensioners living in the EU. Not at all suggesting they're all going to come back, but in the event of no deal, there are things to be thinking about. Kind of some of them start to come back. Kind of what do we need to put in place, or how do we begin to fund that? And I suppose some consideration for the hospice sector might be that without the European Health Insurance Card, which essentially gives you cover to emergency care when you're abroad, we know that it could be difficult for people with long-term conditions or kind of chronic conditions to get insurance cover, or it could be prohibitively expensive for them. And we know for some sectors there aren't any insurance packages out there for them at the moment. So that's an area that we're concerned about too. Public health and disease prevention. We're part diseases and conditions, they don't respect borders. So at the moment we're part of various European Centre for Disease Control. We've got access to data that enables us to track the flow of conditions of outbreaks when they break out. We've often been able to track source an outbreak of measles in England and Wales back to countries in the European Union and vice versa. But that essentially enables us to find out where are these outbreaks happening, and then we can go and tackle them at the source, so we can monitor them as they go on. So kind of what's standing in all of this, and Ben's spoken a lot about this, so I can probably skip a lot of this, but you've all heard a lot about the withdrawal agreement and no deal. Essentially, if the withdrawal agreement is agreed by the UK Parliament, then from a health perspective, most of the issues that I've discussed will be addressed because we'll have the transition period. Without that transition period, that's where we become quite concerned. So, just a really brief overview. So, a no-deal situation avoids this cliff edge that you might have heard, and it gives us the transition period of up to 2020 or even 2022. It guarantees things such as existing rights, so the stuff I was mentioning around reciprocal healthcare, all those arrangements will still be in place. We know that freedom of movement will end, and we're still waiting to hear kind of what a future immigration system will look like. The outline political declaration contains some really useful comments and commitments that would mean that supply chains were unaffected, We'll be able to keep moving goods. They've said things that there are going to be no tariffs on goods. We know that goods licensed before the 29th of March will be able to continue to distribute them post that date. We'll still be able to continue to share data. And importantly, on the last slide I mentioned around public health, we still want to be part of those health security organisations that enable us to kind of protect our health. So if there's no agreement, I haven't turned my papers as quick as I've clicked the slides. So essentially, if there's no transition period, then we have some unresolved issues around medicines and technologies, research and clinical trials, cross-border healthcare and information sharing. Which leads me on to what's the government doing. So we've had guidance from the Department of Health and Social Care. This is some of the stuff that Ben mentioned around the technical notices. We know that they're working with industry on contingency planning, so I think you would have heard about the stuff around stockpiling drugs. They're asking parts of the NHS to sort of identify some of the risks that they could face. Like I said, we've had a lot of technical notices, but there still remains some uncertainty about it in large amounts of areas. So one of the big gaps for us is, like I say, we've got the horse note, the horse technical note, but we haven't got a technical note on how goods will continue to move post-Brexit, which is one of the most important things for us. The staffing, we've obviously got the settled status scheme, and we're aware of some of the concerns around that, but they're fast-tracking. There's a fast-track option for health and care staff. We've seen a bit of a fall-off in the number of EU-based registrants to the General Medical Council and the Nursing Midwifery Council, which is of concern to us. The feedback we're getting from managers in the NHS is that this would be an unprecedented scale, would be trying on top of the existing issues, and obviously we'll be aware that we're coming into winter. Industry has also expressed some fears that they don't think the stockpile plans could be inadequate, thinking around supplies, warehousing and transport. Especially for time and temperature critical products. So this is largely aimed at people who work for the NHS, but there might be some takeaway messages for you. So things we're telling people in the NHS to think so is to reassure staff there is the settled status scheme. We want you to stay. That's very much the message. You don't need to stockpile drugs. We're asking people to look at supply chains. You don't need to do anything, but it's probably just worth knowing and try to work out where do your products come from. So I was speaking to a chief executive yesterday down in Sussex, and they were saying they've recently decided to source all of their food locally, so it's not an issue for them in terms of kind of for their hospital. So they've just done little things where they know that's not an issue, so they don't have to think about it. EU funding, if you have any, it might just be worth kind of looking if you do and seeing what you might need to do on that. It's worth keeping an eye out for comms and guidance from government, NHS and local authorities. So I just thought I'd finish up on a bit of a Brexit stock take. So the thing to know about this is that health is not a standalone topic in the Brexit negotiations. It's largely dependent on agreement being reached on the future relationship. There's a lot of cross-cutting issues, so I've mentioned the way that goods move and customs union and trade. That's why we need an implementation period. What no deal looks like in the UK depends on the reciprocity of the EU, so that's some of the stuff I've mentioned around the technical notices. And so there still remains some uncertainty across several areas. Regardless of whether no deal happens, we know that organisations have already started to make some potentially irreversible steps. So we know that some pharmaceutical companies have started to move some of their operations abroad or looking into how they can do that. Brexit, it sounds obvious to say that the uncertainty is having an impact on the sector, particularly in research. So we know that EU-based researchers or EU-based research organisations are reluctant to partner with UK-led or UK-based research opportunities just because of the uncertainty around it. So our preference is, we'd like an agreement with a transition period. We welcome the withdrawal agreement and the outline political declaration. And we also, I don't know if you remember the Chequers paper, most of the proposals in that tick the boxes of kind of what we would be looking for in health. Timing is obviously an issue, so a key issue for the NHS is the uncertainty about what will happen in the short time scales required to prepare for no deal. And I haven't got copyright for this picture, so take a picture, just be aware of that. Basically reiterating what Ben has said, if everything goes as planned and we get everything we want in Chequers and the deal is passed, then it should be fine. But we know the chaos and the uncertainty that we're operating in. And no presentation on the NHS and Brexit picture of the red bus. I think, obviously the debate at the time was all about funding, but since then we've seen that the conversation is far more nuanced when it comes to kind of Brexit, health and social care.
Thank you very much, Ben. So over to all of you. Comments, questions, thoughts, and anybody with a crystal ball, please declare yourselves now. Oh, quite a few hands. Where's the roving mic? I haven't got one. Okay. Please speak very loudly then. This lady here in blue, sorry.
Thanks, Tracy. I was interested in your settled status scheme. Is that only for registered health professionals? Is it for the whole workforce that works in health and social care?
That's a good question, and I will find that out for you. I know, I just know that it's fast tracked for healthcare staff, but I'll find out the definition of healthcare staff for you, because most of my conversations are largely focused on the NHS, so I need to check that out for you.
Yeah, and also with that, so when you say healthcare, is that only NHS or is that non-NHS organisations as well?
I think I've only.
I appreciate you from the Confederation, so that's your knowledge, right?
Yeah, I need to check that. So at the moment, it's largely been an NHS. I'm not sure if you're wiser than that. I'll check on that one.
Okay, anything that we can't answer today, we'll gather up the questions, we'll find the answers, and we'll pop it in an e-Hospice article to follow up. So please do look out for that in a couple of weeks. Christine, you had a question.
Yes, Christine Gibbons, Deputy Chair of Hospice UK. Have you got any figures about the changes in EU students that are coming to study here and therefore into maybe medical school and then are subsequent doctors and supply? Is there any change that's noticeable?
No, there's no current figure. Sorry, there's no figure for that. Partly because what it requires is a twofold thing of it. Is it because of Brexit, or is it because of is it cultural or is it political? And that's what the government's struggling with, because obviously there are lots of people who are still coming despite Brexit because they're using this time. We haven't quite done Brexit yet, but there are lots of people who we're expecting to not come because they don't feel welcome rather than because it's not legal for them to come. And that's, again, when I mentioned the 86,000 EU nationals who left the UK last year, that's not because they couldn't stay here. As we've heard about the settled status scheme, it will be legal for them to stay here, but one of the things about Brexit that's non-technical is this culture. Do you people feel welcome here still?
More questions? There were more hands up before? Yes, Liz.
It's kind of a general question, really, but we recently had.
Can you speak up a bit? I'm not sure the whole room can hear. Sorry.
We had a letter from our commissioners recently, and it said, "Please, can we confirm that you're aware of the national guidance for health and care sector in preparation for a no-deal Brexit, and can you confirm you've made the appropriate arrangements?" So, I mean, we. You have 20 minutes, your exam question. So I was quite interested in that, and I clicked through to the guidance just to see the kind of things that it was saying, but I didn't know whether to read more into that or not, really, which is why I was interested to come along today, because that to me felt like there was a move to prepare more for a no deal in the health and social care sector, and I wondered if the panel thought that was true, that there's been a... And also if anybody else had been asked to do the same, actually.
I think the answer to that is yes. It's crept up over it's become more of an issue over the recent weeks. I think about a month and a half ago, the Secretary of State sent a letter out to the NHS, basically kind of reassuring of trying to reassure staff what we were doing, largely focused on medicines provision and pharmaceutical devices. And I know there's a lot of work happening between sort of industry and the department on preparing for a no deal. And I think that they're asking people to look at kind of what are their supply chains, like are there things, what are the risks that are out there. But yeah, it's definitely it's crept up on the agenda, so I think it's something to be aware of. And I've got a feeling that there might be I think there will be some sort of, obviously it's the thing with no deal, it's moving, and it's when do you press the button to do full scale preparation without wasting people's time. So I think as we get closer to we'll get the no deal vote, we might see something kind of sent out then, or you might keep an eye on the political situation as well.
I think just to quickly follow up on that, I think I agree. I think that the slight problem, dare I say, with the technical notices is they are politically led, inevitably. The government has certainly tried to make them seem like the steps that can be taken are quite straightforward when they're not. And they extend to things, say with drugs, for instance. Something that comes to mind immediately is labelling, which seems so minute, but the labelling will have to be overhauled entirely because labelling is done by EU consent. And things like if we're getting drugs from down the supply chain, how are we auditing those drugs? Are we using an EU-approved auditor or are we using a UK-approved auditor? Because when they come into the UK, then they will have to be audited by a UK-approved person. So there's lots of kind of secondary, tertiary consequences for all those things that aren't in the technical notices. So I think, for me, a lot of these things that are being sent out to say look at the technical notices are actually rooted aligned to look at the technical notices and then do a lot more research into kind of consequence X, Y, and Z from that.
David first and then Kerry.
I thought actually when you were doing your presentation you might have said that you were stockpiling antidepressants for the massive downer that we're all going to have next year. I had a recent meeting with a couple of CCG chief executives and we were discussing this particular drug issue. So really answering your point, they said don't do too much until after Christmas and then let's regroup at that point when we have a better idea as to whether we're heading one way or another, whether that's good advice or bad advice. That was the advice I was given. Actually, it's a question for Tracy, if you don't mind.
Okay.
Looking at that wonderful big red bus,
Yeah,
our Prime Minister has reiterated that is one of the commitments that will be coming through post-Brexit. So I just wondered what Hospice UK's views were on our ability to get hold of any of that money, if it indeed exists.
Goodness, well the calculations are interesting, aren't they? So if I recall, we had 20 billion set aside for the long-term plan, of which 4 billion went pretty much straight away. I'm looking at Jonathan to make sure I've got my figures right for the NHS pay rises. The 16 billion left doesn't cover inflationary cost increases for the NHS anyway within the period that it's covering. Then we've had further commitments on mental health and community services taken out of that. So what we can say with certainty is that the additional money put into the NHS over the long-term plan is not going to meet the inflationary pressures, and therefore we know, or we're told at the moment, that there'll be real-term cuts. If that gives you an idea then of the hospice sector's ability to take more money out of the NHS for existing services, I think we're expecting there to be the same sort of pressures within CCGs as we're facing at the moment. We certainly know that CCGs are starting to think about merging and collaborating, so what that will mean for current deficits within the system, I don't know whether they'll be able to raise cost efficiencies from that. But I think what we're seeing at the moment is that our NHS funding across the sector, although in theory it's up again and it's around 350 million, it's not sustainable for the levels of people that hospices are trying to look after. When we think about a population needs approach, the more that we're expected to be part of an integrated healthcare system rather than charities sitting alone, the more that we're regulated on that from the CQC, and the more that we're expected to have a plan for our entire populations, it does feel like the funding mechanism with the NHS is broken, and it's something that we're going to be looking at Hospice UK in terms of what we can do about that. And I think realistically, we have the funding for fundraising, we have the funding from the NHS. We're going to have to look at other mechanisms as well, but we're going to have to relook at our relationship with the NHS. It's inevitable.
I agree with that. Can I just check, are we all assuming that essentially they've already spent that money in future commitments, if indeed that money exists?
Are you, sorry, are you asking if
The bus.
the bus has disappeared? Thank goodness for that. The money on the bus, as far as I know, that money has been rolled into the 20 billion commitment. I don't, there's no extra 350 million a day or a week or whatever it said it was.
I think just to follow up on that, I think another thing that's interesting, talking about kind of putting things off till January. There's two things there. Obviously, one thing to say is that what seems like a lifetime ago already, we had a budget a few weeks ago, and if we are heading towards no deal, then obviously we are going to see another budget at the beginning of April, which will be obviously an emergency budget. We don't know what will be in that budget. We know that Hammond tends to disagree with May on the anti-austerity message that she's trying to put out, so we could see pretty big cuts coming then. The other thing is that kind of waiting thing is a wider trend. The Shared Prosperity Fund I mentioned earlier, which obviously would affect housing social care, you would have thought in quite a big way, it's supposed to go out to consultation at the end of 2017. It's now the end of 2018. It was supposed to go to consultation after that at the end of this year. It didn't. So there is a kind of general trend of government putting things off because they just don't know what's going to happen. So when it comes to money issues, that's a big trend.
Kerry.
Well, yeah, it's a much more basic question about the certainty of supply. And I suppose one of my concerns, and I think both of you said in some way, that if we need to look at our local supply chains, and if we're sourcing things locally, that's how we're going to be okay. But if everybody's doing that, which everybody will be, won't they? So we're all pulling on those same local suppliers, and there is only supply in the UK for 5 days or whatever. So you just think about feeding our patients, feeding ourselves, making and the medicine supply. And so I suppose my question is, do you think we should be really worried about that? Should we be buying extra tins of baked beans and stocking them up in the hospice cupboards? Or custard, yeah, that's always a good one. Yeah, all of those. Or is it that, Europe wouldn't let us, and our own government wouldn't let us starve for the sake of import controls and customs border issues? Well, I don't know. I don't know what to think about that. I'd just be interested in what you think about it.
Well, I suppose the starting point for us is on health. There's clearly a mutual interest between the EU and the UK continuing to cooperate. Just when you look at the scale of trade between us on drugs and medicines, we're both dependent on each other for supplying those things. So there's a bit of me that thinks when it comes to it, we'll have things in place to rectify that, because when you look at some of the countries that we import a lot of our drugs to, like Germany, I think France and the Netherlands, they don't want to see medicine shortages in their countries in the same way that we don't want to see a shortage in our countries. And on medicines and devices, I think the message is very much like, you don't need to stockpile. I think they're working with industry to work out which are the key drugs that we need in place to avoid that situation from arising. I don't know, on food.
I think there's a chance. It's politically difficult. There's a chance that if we get to mid-February and there's no deal forthcoming, that the government will try and get these mini deals that we're reading about through. So I think the likely ones are flights, just getting diplomats to Brussels even, medicines, foods, fissile materials for nuclear power stations, things, really, really important stuff like that. I think they will try and do mini deals on that, so that, because as you say, it's not in anyone's interests for anyone to be starving our government or anyone's government. So I think there'll be an attempt to rectify that come what may, and almost separate to Brexit, because it's a human thing rather than a political thing. I can't speak to the likelihood of success, but I would have thought that the EU aren't going to be punitive in that sense. You'd hope not.
Any more questions? Well, there's some from around here. Any more for any more? Jonathan, do you just want, I'll put you on the spot, do you just want to wrap up by just explaining the recent letter that we've sent in to the Brexit Secretary and what we're trying to find out? I'm not promising that Jonathan has any answers because we don't, but what we're attempting to find out at Hospice UK.
No, absolutely. So we know this is something it's worrying all of us. It's worrying all of us as citizens. It's worrying all of you as hospices, and as much as we would love to have, as the national charity for hospice and palliative care, we would love to have the answers. None of us do, as we've heard this morning. But one of the things we did do last week, and there's an item in this week's hospice leaders briefing as well, if you've not had a chance to have a look at it, which links to a lot of the sources and guidance that Tony and Ben have been talking about as well. And last week we also wrote to the new Brexit Secretary, if he's still in post this morning, who knows? It seems to change rather quickly. Really just to ask precisely the point that Ben raised, although there's no clear guidance forthcoming, we're not going to get the granular detail that we would all want and need and expect, perhaps. But we did write to the Brexit Secretary last week just to make the point about some of the unique challenges that hospices face. For example, on the supply of drugs issues, we're at the sort of very end of an interesting little NHS cul-de-sac, aren't we, compared to the rest of the system. So asking for some clarification. Now, whether or not we get anything substantive or useful as a reply, we would, of course, let you know.
And I think it's also a call out to all of you that if you have any intelligence, anything that's sent through from your local CCG or your local area, then please do send it to us as well. It would be good to be able to circulate that. Well, thank you very much for your time. I'd like to once again say thank you and show our appreciation to our speakers. And within a few minutes, lunch will be served in the exhibition hall. So can I also encourage you, please, to go and say hello to the exhibitors. It's with their help that we can put on a conference like today. So thank you.